Welcome back to Morning Express. It's time for the newsroom, and just to introduce the panel that we have this morning to participate in that conversation, we have Patrick Gadara, who's a cartoonist, also a communication expert, Eric Latif, a journalist, and David Ohito, who is a digital editor with us here in The Standard. And gentlemen, thank you for joining us this morning.
Thank you.
And for having you here. Now, of course, we'll start with what has been in the headlines for the last few days. We are on day 3 of the doctors' strike. And of course, we do know that that's really, literally a matter of life and death. And maybe just looking at the history, let me start with you, Eric.
Coverage that they need, and the issue is not getting the coverage that it needs. It is getting the coverage that it needs, especially, putting the context of what exactly is happening on the ground, who's suffering, who's at the, receiving the brunt of this strike. My beef, though, is always, I remember this, the first time that I saw doctors wanted to go on strike, KMPDU, and I tweeted and said, why are doctors going on strike? And the doctors responded to my tweet and said, you guys, you need to understand the issues. It's not just about the salary. And I even hosted them on a show. And the issues that they raise are issues that we don't cover as much as we should. Because it's not just about the salary. Now, we are going with the hashtag Lipa Kama Tenda, which is salary. And everybody may just start thinking, these guys are asking for salary and all. But it's more than that. It's more about the welfare and the status of Kenya's healthcare system. What kind of doctors do we have? How are we posting them? What kind of support are we giving them? As a doctor, as you work in certain facility in a remote area, let's say you're working in Garsen, at a hospital in Garsen, what do you have to help you do your job? And they keep saying we don't have this. Okay.
David Ohito, in terms of protracting and making it very clear to the public what their grievances are, just like Latif mentions, the hashtag is Lipa Kama Tenda, which basically is concentrating more on the salary. But it's not just the salary. It's not just the 300% that they're talking about.
Yeah. I'd want us to look first at the working conditions in all these public hospitals. And we all know the sorry state that we are in. Devolution has tried to equip the hospitals, tried to get drugs, but it has not perfected the way you'd want a functional health system to operate. But I think the media has really highlighted the real issues. But the bigger problem in this country is when you start paying barely literate MCAs higher than surgeons, then there's a big problem in this society. I really do not understand why we do not want somebody who has taken 5-7 years studying medicine and guy who just dropped out of class 7 or 8, pay them the same salary. It really doesn't add up. So I think we've got to sit down and nail this problem once and for all if we want a functional healthcare. I belong to the school that nurses and doctors, the long hours and the exposures they get during their work experiences must be compensated fully in a fair objective that is commensurate with their skill sets.
Okay. Gadara, your thoughts on the coverage so far?
I think I to a large extent agree with what Eric and David have said. I think in terms of coverage, the strike itself is being covered. My beef, as always, is with the context, what goes beyond
and the depth.
Right. I think that this is actually an opportunity, if you will, for us to actually interrogate the state of our healthcare system and how it actually is structured and how it actually doesn't serve, to a large extent, the functions for which it is set up. I'll give you an example. When you look at the reporting about the people who, quote-unquote, escaped from Mathari Hospital, and it's very much portrayed almost as if these are inmates running away from a prison, and there's no interrogation of why are people kept in Mathari, seemingly against their will. There was an expose done in 2013, by Associated Press and also by The Nation, about conditions inside there. And remember, in 2013, in the absence of a doctor strike, you had 40 people who actually ran away from Mathari, and there was talk of how they sleep on floors, how they are not fed, how they are kept constantly drugged. etc. That the conditions there are awful. So it's actually not surprising that people want to get out, and this doesn't inform our reporting about these guys, just seen as a consequence of the strike. If you look at the studies that have been done about the status of healthcare and how it's provided, it shows that a lot of our hospitals are actually not equipped to provide even basic healthcare. I think it was like 60% can provide the basic level of healthcare. That was a study I think done in 2013. So we need to actually drill down beyond simply, as he said, salary, and paying guys. The second thing I would say is there is a pattern that you can see here of government signing up to agreements and then refusing to implement.
Not honoring them.
Right. I remember the same thing happened with teachers. So my point is, again, we need to go beyond simply the crisis as there, but to look behind it and to see, well, why does government behave this way? Why does it sign CBAs and then try and walk them back afterwards? Is it simply a matter of let's kill the crisis now, but not really do anything to solve the underlying issues? And I think for as long as the media doesn't concentrate on what those underlying issues are, then we'll always be treated to this charade where there is a crisis, agreements are signed, and then a few years down the line, they're not honored, and then again, we go into another bout of crisis.
Okay.
Michael, there's an issue that we keep talking about every time we discuss, specific reporting of some certain issues. And this is having dedicated desks in newsrooms to report on some matters. For example, across the major media houses, Standard Group, Nation, even if we went to Royal Media and the Star, right? Radio Africa Group, even at Capital FM, we do not have desks that have a health editor and a specified, health journalism department. So many of these issues that we are saying could have come out even before this strike. And we'd be having somebody who sits down and actually writes a story or tells a story of the status of healthcare in Kenya. And that, therefore, would be able to, avoid just concentrating on the issue of pay. And the issue that, when these people sit down with the minister, with this cabinet secretary and the government, they're discussing their pay, they get the 300%, they've been promised 300%, go back and start working. Because that doesn't solve the issue, like that I'm saying. It's about extinguishing a flame, but leaving the coal still burning. If we had dedicated desks that have trained journalists on issues of reporting on health and health matters, because health is deep. You need a good understanding of what health entails. You need a good understanding of what are the soft issues, what are the hard issues. If we had these kind of desks in the newsrooms, it would be helping some of these things.
Okay. David Ohito, do you think that's true what Eric says? And more importantly, why do we not have those dedicated desks, especially given that some issues require a lot of knowledge and a lot of research and a lot of insight into them? There is health, there is things like security, which you still don't have desks, but you'll find when there's an issue is when we have, reporters running towards that.
Sure. We have socialized our media around politics far too much, and there's really lack of what we call specialization, as we have seen with the best practices in international correspondence and so on. But even if there are no special desks, I would recommend research desks that would do these stories. And when you say host doctors here, your earpiece giving you latest information, the right data, the right questions to ask, so that we do not look like sugarcoating some of these issues. But all that said and done, I agree with Gadara that we must be a country that respects some of the agreements we have arrived at. This was a collective bargain agreement signed way back in 2013. And there were all signs that there would be. We've seen it in the education sector. We are seeing it in the health sector. We've seen it with civil servants. Must we always wait for crisis moments so that we start having cabinet meetings late into the night? It shows how not we are organized or how poorly we are organized in terms of management and governance within the structures we have across the country. And we must start finding solutions to forestall this. Hospitals should be places where people walk in freely to seek treatment, good health, and now, as you've seen the good headline, we've turned them into factories of death. That should not be happening. And you know, when you look at our cabinet secretaries, permanent or principal secretaries, I mean, it's life as normal. They're eating their bacon,
so business as usual.
Bacon and, you know, omelets down and say,
covered.
You've not heard a word from the mouthy politicians, both in opposition, you know. There's very little. It's just a blame game now going on, and it's really a sad situation. Whoever is looking at the images from Kenya, I think we are not far from a failed state.
Yeah. Eric, looking in terms of asking the right questions to the right people, looking at the cabinet secretary right now, are we still guilty, and I'm sure Gathar will probably jump in on this one, of reporting he said, she said? Right now, the cabinet secretary says that we called them for talks and they did not honor us. We are waiting. There is the...
It's illegal.
Yes, illegal. and we are printing and reporting that, whereas we are not going into the history and finding out from July 2013. This is, you know, a long period of time. For you to be telling us to wait till January, I think it's the 5th, that it was supposed to expire. So maybe looking at interrogating and asking the hard questions.
True. And that brings a lot of point to what David is saying. If we had a good research desk, for instance, doctors are threatening to go on strike next week.
What it means?
We should have said that. We should have said, you know, since 2013, this is what they signed. This is what they've not gotten. This is why they're going on strike. This is what it means. This is why, these are the questions that, need to be answered by the cabinet secretary. So whenever even the cabinet secretary is calling the media, he knows the questions I need to answer are this. Not the fact that I had called them to come at 3 p.m. and we waited here until midnight and they have not come. That's neither here nor there. It's why haven't you honored this? What's the plan? Why didn't you get there? You have the three cabinet secretaries. Imagine we had the CS Rotich, Treasury, and then you have the CS for Health, Mailu, and then you have this Council of Governors representative there. These are the people who actually should be answering those questions. Why hasn't it? Why are we getting here? Not, so what's going to happen? Are you waiting for them tomorrow? Will you call them again tomorrow? What do you want to tell Kenyans now that the doctors are going on strike? Bad questions.
I think this is a very much a management by crisis. And I think in the end...
From the media perspective or from the health?
I think from government. I think the failure is a failure of governance. We knew the strike was coming. You know, it was announced. They gave the requisite 21-day notice. Government knew this was coming. You know, so another question that really needs to be asked is, what did they do to prepare for it? You know, it cannot be simply the case of them saying doctors have walked out. Well, we can't do anything about it. You know, they are charged with managing our welfare. They're very well remunerated. You know, your CSs and PSs to manage this sector, you know, going down also into the county government. Question is, what did they do when they knew a strike was coming, was pending? You know, so for me, it seems to me very much like it's simply a government operating on the hope, and the press is allowing them to do this by portraying it almost as if it is understandable that they've sort of been caught. You know, unawares almost.
Flat-footed.
Yes, you know. The fact is they failed. The fact that the strike itself happened is failure. You know, it should have been preempted. They should have, you know, the meetings they're having now, why didn't they have them then? The other thing, when you talk about the he said, she said thing, yesterday on Citizen, you had the head of the doctors' union. You know, and you were saying, well, we didn't skip any meeting. We went there, we were there from 8 in the morning. You know, our team was there. They waited till like 3 in the afternoon, got into a meeting where the CS refused to discuss the CBA and was essentially more interested in berating them. At least that's what he was saying, you know, and stuff. So, and I think we need to go beyond this, you know, beyond simply saying who turned up, who didn't turn up. What are the issues? What should they be discussing? You know, and I think drilling down to asking government, putting government on the spot, because it is a failure
on the part of government,
you know, to ask, well, why does Mailu still have his job? Why does Muraguri still have his job if this happens, you know. If we've got a situation where we've got a system, I mean, if you think about our health system, and there's a lot of talk about whether it should be devolved, etc. But we rarely talk about what the counties are doing and how it links up to a national health strategy. So they go around buying ambulances, you know. Nobody ever goes and checks them out and asks the doctors, well, is this what we actually need over here? How does this actually fit in to the wider plan for government? These are not questions that are asked. We are more sort of concentrated on who's getting what money, you know, to see, as opposed to why should they get it and for what purpose? Why are they there? And what is the plan and how is the plan joined up? So I think we need to be much more clear in explaining to Kenyans how their system is structured and what the faults and gaps are within that then result in the sort of chaos we have now.
We must remember also that health is a devolved function, so governors also have their fair share of blame. But last week I was doing a tour, which is why I was not in the newsroom, of some counties in the western part of the country. And we had real serious conversations with governors. And they say, county like Kisii, for example, 40% of their budget allocation goes to health.
40%, that's
yes,
huge.
40% of 6.5 billion shillings. That is not petty cash. But the governor says, even as much as 40% goes to health, he inherited a lot of what he would call deadwood stuff, you know, from cleaners, sweepers, guys who were inherited from the former defunct county councils. And, you know, you have a staff that you really do not need. Two, there are specific skill sets that you have that you require specialized, well-trained people to operate these machines. The government has gone and forced equipment on the counties.
To the county.
Yeah.
They have not considered.
Which they had actually brought up, and it was a big thing when the county government had actually declined to take
But as Gadara and Eric say, which journalist has interrogated what is the true story of these high-cost equipment being forced on counties? Who are the skill sets that will be assigned to operate this equipment? In the unlikely event that you have this equipment not operating, then for what reason should counties be paying or should we be servicing loans for? Three, there are things like free maternal health care, which was a key campaign strategy for Jubilee. Which mother has been delivered free of charge? Those are begging questions. And we know people are paying. And there's also the question of procurement of medicines or drugs and other medical supplies. There are so many big questions around this. The county governments have capacities to really handle that kind of thing. Can a county, for example, handle efficiently a level 5 of a hospital like in Kisii or in Sia and so on? So what we've had is trying to refurbish the hospitals, but the doctors and the workers there, the nurses and clinical officers, have not been motivated to do their work well. So there's a lot of mismatch going on. And when, say, a county spends 30 to 40% of their budget on health, what does it mean? Is it that people are too sick, or there's a model which is wrong? So we really need to take the story beyond just reporting there's a strike and now patients are dying, and to really interrogate the facts and who supplies drugs. In a county where I come from, the medical officers who were fired because they took monies to procure drugs and there was no drug supplied. And who are the drug suppliers in the wake of KEMSA that used to do it before we devolved health functions?
All right. Eric, maybe moving this conversation forward, would this be an opportunity for us to also, based on what you're saying, look at the cost of corruption, because there's also corruption involved in this particular health sector, and our doctors are going on strike, not just because of the salaries, but their facilities. They don't have people to work with, they don't have the tools to do what they need to do, to a point where they've said, look, we need to put our foot down and let the whole country know what the situation is. But would this be an opportunity for us to also paint the picture of the cost of corruption?
It actually does. And by and large, it's already implied. The fact that doctors are going on strike because of all these issues that they're raising is already an implication that there is a system rot. Like Adara is saying, it's not an emergency. These issues have been there, have been discussed, have been raised for a long time. They haven't been addressed. Why have they not been addressed? It's because either somebody somewhere does not want to address them fully, or somebody is addressing them on paper so that they get the money to, you know, go and steal down the line. The cost of corruption is clear. Like Ohito is saying, if you go to, you know, now to the particular facilities on the ground, and you're finding a facility is running, and you look at how much has been allocated to this facility, how much is actually getting to the facility, what is it doing at the facility, is it actually arriving at the facility level? Because sometimes we see these stories sprouting somewhere, you know, where you find a head of a certain hospital saying, this is our budget, this is how much you require, but this is the only amount that we receive. Why do we only receive this amount? Is this what is on paper that you have received? Is this what has been allocated to you? Why is it the money coming like you need it? And therefore, what is the cost of the money that you haven't received to the health of the community? It's a big issue. Reporting on corruption, reporting on... That's why I'm coming back to the whole issue of understanding health system. Because if we understood the health system as newsrooms, and we set aside a number of journalists who went for specialized training, who, it's not even much of specialized training, it's basically just dedicated training. Go attend workshops, have linkages, have contacts with the right people, know doctors, know nurses, know the people who are in that whole chain of the healthcare. Then you'd be able to start understanding their issues. You'd know also what kind of questions to ask. You'd know what kind of stories to bring and what stories to tell. There are very many stories that we'll be able to be telling that would be putting up our headlines every day, not on Raila has said, but on this is the issue that's happening on the ground.
Madara, I see you nodding your head, but as you answer, what's the way forward? What are some of the things that you'd like to see moving this conversation forward? We're on day 3 of the strike, and at some point, it'll actually become a tired headline that doctors on strike. That conversation needs to move to a different level, and also to inform Kenyans, this is where we are at.
Yeah, but I mean, it's pretty much what they've said. We need to be much more concerned with the systems that we have, rather than simply the events that are happening around them. You know, I think we need to start going deeper into the causes, you know, into reasons. What are our actual problems? You know, why is it that we can afford to pay retired presidents X millions in violation of court orders, actually, but we can't afford to pay doctors? You know, why is it that we spend much more on hospitality, as has been put out on social media, you know, and we still claim that we can't pay doctors? I've just seen the headline about MPs are now getting, what was it? 6.7 million, you know, just after 4 years. You know, it seems to me when it comes to the political class, there is never the argument that there are no resources. In fact, they give us the opposite argument, you know, that we can afford this.
Yeah, there's plenty of resources.
Yeah, precisely. But when it comes to paying other people, the people we actually need, you know, then their issues are always raised. And I think this points to a system that is geared to solving the problems of the elite, of the politicians, rather than solving the problems, the everyday problems of Kenya. And we've got to tell people that this is the consequence that these systems have. You know, I think also that we, going back to what I'd said before about things like mental health, we need to disaggregate the crises that we have, because there are many different crises under this rubric. You know. So we need to look at the state of how it is provided. So for example, we've got just one psychiatric hospital in the entire country. That's Mathari Hospital.
After all these years.
You know, so we've got to be asking, you know, if health is actually devolved, you know, what are we doing about mental health patients out in the counties? Why do they all have to be grabbing their people and sort of bringing them to Mathari, which is already overstretched and under-resourced? You know, and I think when we start asking those sorts of issues, And we go back and we see the government forcing equipment and not really discussing, what is the need for this? It can't be that all counties suffer from the same or have uniform needs, if you will. They've got their priorities depending on what is affecting their particular populations at the moment. Okay. And that was the whole point of devolution, is that those decisions can be made at a more local level, not enforced from up above. And I think we have failed as media to essentially drill down and explain what those needs, what those priorities are at a local level, and have been sort of captured by the political discussions, by this need by government and ruling party apparatchiks to be seen to do something, to grab the news, if you will, as opposed to actually trying to solve problems.
Okay, let's move on to something else. And the other stories that have been making headlines is to do, of course, with corruption. And this is mainly pegged on the Auditor General's reports. We started with the counties, then we have now members of parliament who basically have all, I think out of 290, those 273 who could not properly account for CDF money that was literally under their watch. David, in terms of painting that picture, especially in light of 2017 and having Kenyans make an informed choice, again, looking at the cost of corruption and why we allow it as a country.
Very painful. And just before we even wind up the whole story, I want to see the first time a governor would walk to the county referral hospital and seek treatment. The other day we saw Isaac Ruto fly to South Africa. Why would we do so? We saw that when Nyong'o had his cancer condition. He flew to the U.S., Texas.
Kibaki the other day.
And yet he was Minister of Health.
Yes.
Yep. Even Beth Mugo was
Next door, President Makuvuli's wife, the First Lady of the Republic of Tanzania,
uses a public hospital.
When will we get to that level now of having confidence about our own institutions? But that shows you how corruption has ruined what were good institutions, including our national hospitals and referral hospitals. And I don't know, the price of corruption in this country is just deafening, it's blinding, it's actually killing what was a beautiful nation. And the losses we are seeing, the pilferage of public funds, and the way we, in the media and society now, turn literally people who have ill-gotten wealth into heroes. It's really a sad situation. And this is done as the religious institutions watch and become part of it.
But the question would be, Ohito, how are we turning them into heroes? Is it that we're not telling the story right? Is it that we're not quantifying? Because now when you talk about, for instance, 6.7 million shillings being paid to a member of parliament because they have served for 4 years, maybe quantifying what can that 6.7 million times the number of MPs do for you as an individual in terms of your...
That is how we would move the story to the next level and change our reportage and just also raise the conscience of society. And then we must also start pushing for how will we tackle this monster called corruption. There's been very limited success story in the fight against corruption, and you see what's happening at the EACC. We can't even get a chair. The process of recruiting one. And nobody in their sane status really want to take that job anymore. So it's really a big, big problem. And whether it's a commission that fights corruption or protects the corrupt is a question that one day we may need.
We have to. Gadara, how do we move that conversation on corruption to make sure that Kenyans actually realize? Because at some point, it's getting to, I've even had, some leaders, Murkomen is on record saying, if Waigoro, for instance, is not prosecuted, and God knows whether she's going to be prosecuted or not, we might as well legalize corruption. So we're getting to a point where we are almost accepting it is the norm.
First,
or maybe we've accepted already.
Well, I don't think it's so much a matter of accepting whether corruption is the norm, as it is understanding what corruption actually is, and the fact that we've got a system where corruption is built into it. Don't forget that what we have now as our governance system is something we inherited. Yes, we passed a new constitution, but we have not really gone the way of implementing it. What we still have is the colonial system. And that system was created essentially to extract resources from the population and give it to the colonials, then to a small elite. And those colonials have now been replaced by our fellow Africans, our fellow Kenyans, black Kenyans like us, but they're behaving in exactly the same way. And I think until we understand that this is a systemic thing, that it is not so much about simply replacing who sits there. If we take the lessons of 2002, where we elected all these civil society guys, people who had records, who had stood against Moi, had been tortured, jailed, exiled, for standing up for the right thing. But once they got in, almost to a man, they all turned. It wasn't surprising the other day amongst the MPs who were named. You could see Mutava Musimi. Look at his history. When he was at NCCK, very strong, very solid guy.
And of course, coming from a religious background, one expected...
But it's not even the religion. The point is, the system in there incentivizes certain behaviors. Systems create their own behavior. And I think until we start understanding that, then we'll be able to ask better questions about what we're doing, corruption. We've reduced the whole discourse of corruption to prosecutions, but not asking why is it happening in the first place. Yes, prosecutions are important. I'm not saying that don't have them. Of course, have them. Go after these people.
But
understand why it is that the EACC seems to be handicapped in actually going after the people we call big fish. And the fact that a lot of our so-called independent institutions don't seem to work or to behave as if they're independent. This is because the system they're in is still very much geared towards enforcing or looking after the interest of a small group of people at the expense of everybody else. Think of the police vetting and what we learned from police vetting. Where are the investigations of senior policemen who are getting these M-Pesa Chama payments, from their juniors? Nobody asks so much about that. Again, police reform is reduced to let's buy them equipment, let's give them welfare. Not really look at let us reform how policing works, which is what, and again, it's not this knowledge doesn't exist. If you read the Ransley report, if you read the TJRC report, they all speak about the nature of the police. And in fact, Ransley called it a citizen containment unit. It's there essentially to contain you, to police you, so that you don't cause too much problems for the people in power. And that's what I'm talking about. Let's redefine this. Let's stop looking at corruption as an aberration of the system, but actually what the system was set up to incentivize to do, and it does that very well.
Okay, Eric?
I keep telling Gadara every time he comes up with that issue, he says it's system, and I agree, it's system, and it's system that started pre-colonial. It was engineered in a certain way during the colonial era. We adopted it, and now we are saying we need to think different so that we are able to sort out the system. That's the people. And the people, like you're saying, that this is the same discussion we keep having. If you look at the people that we've talked about, the people who are the champions of the second liberation, and they get into the system and they're corrupted, what does that mean? Does that mean that we don't have principles as individuals? Does that mean that the system is so strong that no matter how clean you are or how good intentioned you are, when you get into that system, it just sucks you in? At what point then are we going to be able to look and say as a people that it's the system that we need to change?
And because
everybody who's talking outside the system will talk about the system. No, but and then you get in, and the rest of us agree with you, and we say, yes, Gadara, in fact, go in there as our leader, help us to clean it up. We are behind you.
But that is the problem, is go in there, help us to clean it up, we are behind you. Because once that person is there, the mechanisms for actually keeping them accountable do not exist. So, for example, you're told, you can change your MP, you can recall your MP. You've seen the laws that the MP passed about recall. which essentially even the court said, this is essentially designed to defeat,
to make sure, yes,
to ensure nobody's ever recalled. So we can't really blame people for not holding the system to account when we've deprived them of the means.
But that sounds like catch-22 together, because...
What is the solution?
Right.
Here is the issue.
And here's the thing, where I would agree with you.
Here's Gadara saying that, this is, we need to fight corruption. But Gadara gets in there and Gadara gets sucked in. What happened to your
but here's the point. Yeah, and here's my point is, I would agree with you that in the end it comes down to people holding or insisting that this system be changed, become one that serves them. But for them to do that, they've got to recognize it. They've got to be shown that this is what it actually is. Unfortunately, our discourses about it, and what we tell people to do, is essentially just vote in better people.
No,
but that is not the problem.
We actually don't
and that's what
we vote out people.
No, this is what we keep being told. Let's vote in better people, because if we get in, Magufuli, he will sort out these problems. No.
I just wanted to say we've run away from what we are calling lifestyle audits, declaration of wealth, and can say that I saw governors who were elected 4 years ago. They were living in semi-permanent houses. Nowadays, they are living in the equivalent of malls, not mansions, malls. And God forbid, we know what they earn.
Yeah, David, I mean, if you think about, sorry to interrupt, but think of wealth declarations, which are required of all public offices. Why are they kept secret? They're kept secret because they are not means. It's about what it looks like. It's not about what they actually achieve.
And this brings me now to the point where, when we talk about a system, are we not then trying to blame an amorphous being? Whereas we do have systems in place already that can, for instance, when you talk about wealth declaration, it should be clear.
Sure.
From when the time you enter office to 3 years down the road, something there does not make sense.
But if it's kept secret, how is it clear? How do you know?
Maybe that's where we need to come in.
So this is the sort of things that we articulate, But we don't have discussions in the press about why is that wealth declaration secret. That's not the thing we discuss. We discuss, why is there prosecutions? You Kenyans are bad, you're not electing good people. Because we're not looking at the system. And it's the system, the systemic problems that we have within it, the incentives within the system. When policemen are paying their seniors to get a posting as a traffic policeman, that tells you something.
When somebody, if Michael Gatonga...
It's not motorists, sorry, it's not motorists corrupting policemen, as they like to tell us. It's policemen extorting from motorists.
From motorists, okay.
If Michael Gatonga had a problem with rats in his house, he would decide, I want to get rid of the rats in my house. What would Michael Gatonga do? Michael Gatonga would go to any means to make sure that he gets rid of the rats. He will make sure he doesn't burn his house first. So he'll look at, rat, he'll get the traps, he'll try everything. This particular poison is not working, I'll try a different poison, I'll try...
Rats and rats.
I'll try removing my foodstuff from the house and keep my foodstuff in the car, something. Try and get the rats out of the house.
By hook or by crook, those rats must leave.
By hook or crook. But it's Michael Gatonga who decides. Come back to my point. When the day that Kenyans decide they want to fight corruption, they'll have that discourse. They'll sit down and actually look at and ask themselves, what is not working? And they will make sure that it works. They'll say, it's a system that's not working, fine. And I think that we are in the process of having that continuous conversation, but we are not genuine. We are not feeling the pinch of having a rat in our house. We still have food on our table, and we are thinking that the rat is just eating the crumbs off the ground. Until that rat gets into the fridge, and you wake up one morning and you find there's no food, that's the point. Right now, we are just there. We talk about it superfluously. And somebody comes and, we start talking about, like, the governor so-and-so, whose lifestyle we knew before we elected him, and now he lives in a mall, right? And we laugh about it. And when he comes to address us, we actually clap. We actually want him to leave us something. We praise the guy.
So in effect, are you saying that Kenyans literally are the ones allowing corruption?
Sure, but it will
shall
catch
be
up.
a,
If you read
it shall be a
history,
society that wakes up and decides this is the end. We have reached the end of our tether. And that's the day we shall break the rope.
David.
you know, the way corruption works is that one day, like Eric ably put it, it will eat all of us until there will be nothing left to eat. And then people will just run into, it happened in Burkina Faso the other day. I think we've had enough of these politicians. I think let's go for them. And they burn down the parliament. And then there's some order which starts to be restored. The level of poverty, because of corruption, we can't get jobs, because there's no single functional government institution. There's no profit-making industry, apart from few telecoms here and beer makers and the banks who are in super profits. I think it's going to eat us up, and people will rise one day. It's a potential time bomb, and I think we need to start addressing more seriously than we have ever done.
But I think there's a rather simplistic view that's being put out here. There are people who will rise up, and they will rise up because they know the reports, they understand how corruption has fed down into this, they know what needs changing. You know, that's my point, is they actually don't.
No, they'll not rise up because they understand.
Yeah, they will rise up because
they have nothing.
They have nothing. Precisely. Yeah. But if we are asking about what we want to solve, what we want to fix, then we need to articulate to them what needs fixing. You know, we need to have that discussion. And that my point is that is what's lacking. You know, it's not that people don't feel the pinch of corruption. It's trying the lines between, all right, how do we actually fix this? You know, it's like, I mean, in the example you gave of a guy with a rat in his house, if he doesn't actually understand, you know, how to get rid of rats, he can try a myriad of things, lots of things that wouldn't necessarily work, you know. But we've got a situation where we've got reports that have been done. We've got people who studied governance. We should be talking to these guys and understanding how corruption is embedded in the fabric of our governance. And then how do we actually root it out? How do we restructure government so that it serves people, so that it is accountable to them? When it fails to do something, they can very easily get in and get, and punish and exact punishment over public officials. We've set up a system where they really can't, where it is dependent on a few. And when we talk about the discourse on corruption, it is a discourse carried out by a very small group of guys that then informs everybody else that this is what the issues are. Now, the media is part of that discourse, but because it doesn't bring out what the actual problem is, then the rest of the country has, you know, really just goes by the seat of its pants, and that's my problem.
I agree with Galera. Now, there, yes. We're in agreement. We're in agreement. The thing is, that person needs to be informed of what the issues are or where the failures are. And that's where now we come in as well, that, you know, the elite that's discussing, that's having this discourse, the media, the fourth estate being part of it, the fourth estate needs to understand what the issues are. And probably now coming to the context of the newsroom, what is the media's role in this? I think the first thing is for us to understand, for instance, how well do we understand, how well are media houses able to actually decipher, to read and decode the Auditor General's report? Do we take it and look at figures and say, missing, and go and report, say,
X amount is missing.
X amount stolen. Is that what the Auditor General's report is saying? Is the Auditor General saying stolen? Is it saying unaccounted for? Is there a difference between those two words? Do we understand it? Because from where I see it, sometimes I look at, you know, what we are writing and is saying 20 billion lost in Nairobi. Put it into context, really. 20 billion out of how much? Possibility of that 20 billion getting lost. And nobody noticing until auditor comes, auditor does report, auditor releases report. Is that what the Auditor General has actually said? That 20 billion is lost? Or how much is he saying has been lost? How much is he saying is because
it's not accounted for.
Poor accounting? And how much is he saying this is a system failure? If you fix the system, it will be very clear how you spent this money or where this money went. Is it lost? Because lost, you know, the way we have got into a point of reporting. The word lost means stolen, means eaten, means, you know.
In fact, we seem to have mixed, we seem to have mixed things like fraud, corruption, misappropriation, lack of accountability. And maybe, Ohito, as we are now almost winding up, looking at now the Auditor General's report and how we can contextualize that for the Kenyan who is literally not well versed with accounts, to understand what exactly is the Auditor General saying and what does that mean on the accounting officer.
Sure. It's been a very difficult terrain also for the media in Kenya, we must admit, and I agree with Eric that we haven't done a very good job that end. What an auditor does is to come and ask you, we gave you this amount of money, and these were the budget lines or budget items. How have you spent them? What is the cash balance that you have in the bank account? And then you show, and then he says, if you spend this money on travel, show me receipts of travel and accommodation. If you used it, sometimes when he has no supportive documents, that's when he says, this county cannot account for this amount of money. But it does not automatically mean the county lost the money. It means that the auditor's queries have not been answered and no documents have been availed.
To support.
Yes. I was listening to one interesting case when, about one of the counties, and they said ESCC had raided them and demanded that they show receipts. So the receipts of expenditure were taken to ESCC. At that time, the auditor was busy doing their
his
work.
audit checks.
So they're saying, can we have receipts? No, we don't have them. Yes. So it becomes a ping-pong game, and until the auditor gets those receipts, he cannot give you clearance about the money. But then there are also queries that which are also outrageous. Look at the other day's headline of shillings 20 billion for
on Governor Kidero.
Yes,
which has come out to say that the county government has received 23 billion. So how can he have?
Oh yes, some of them are difficult to understand, and you see when journalists start running into that. And he was lucky to have some of the best guys running to his defense, the controller of budget and commissioner for revenue allocation. And it shows you how our reporting is still not that watertight to eliminate and separate chaff from wheat.
Okay, there are closing comments as well.
I think fundamentally the opaqueness of how government operates is problematic. We've now got the Access to Information Act, which I don't think is really being put to lots of use. You know, that requires government or government departments essentially to put on their websites lists of all the contracts that they're having, you know, who's doing them, how much it is, etc. So that it's available, publicly available information. You can check up on roads, you know, what has Kidero done on roads, you know, who are the contractors, and then you can check your local road and see what's, you know, it's in. But I think the discussion needs to go beyond simply the financials of corruption. You know, the opacity of government, for example, in the nomination, I mean, right now, the selection of IEBC commissioners, you know, you had 750 people apply. You know, they shortlisted them to 31 or 36. You know, 5 for chairperson that were then thrown out. But nobody explains on what basis was this shortlisting done. We do not know, you know, about what their criteria was for saying, well, that guy and not that guy. That sort of opacity is bad. In fact, the 5 guys who are rejected, we are redoing the chairman thing, those 5 guys are being interviewed for ordinary commission.
All right, we need to wind up right there. I'm told we're really out of time. Director says we have to wind up right there. Thank you, gentlemen. And that's where we're going to have to wind up the newsroom because, well, Life and Style begins on the home channel in just a few minutes. Right here on KTN News, well, we have some news updates, and later on, we'll be looking at your health. We'll take a short break. We'll be right back.